Hi, my name is Letitia Chambers, and I am here to answer the clinical reasoning questions for our PhysDiz and geriatric courses. Okay, number 37. The OT is completing a pre discharge evaluation after the client's 3 months of outpatient OT following a hand injury. The individual has not been able to work for 3 months and is unable to perform all the job requirements as a truck driver. Which OT recommend which should the OT recommend at discharge? I chose the answer C, work hardening. I chose this answer because the patient is already been participating in 3 months of outpatient therapy and has not participated in any, he's not able to perform any of his job requirements. And it is time for him to participate in those activities so that he is able to return to his prior level of function or as close to it as possible so he can get back to work. So, in a home exercise program, he's already home at this point because he's participating in outpatient. So that wouldn't be beneficial to him because he's probably already completed a home exercise program. And home health OT, he is not bed bound. He's participating in outpatient therapy. So he does not qualify for home health OT. Okay. The next question is number 1. An OT is preparing to evaluate a toddler who has upper extremity orthopedic concerns and difficulty with self feeding while at childcare. How will the OT most likely obtain initial assessment data? For this question, I chose the letter C, observation of the child during eating activities in the child care center. So, when doing an evaluation, in order to assess what we want to see from most of the best time to do it would be in real time. So, if you're observing the child in their environment, in their setting where they perform most of their activities, which is play for a child, observing them in this setting would be most beneficial. Measuring tools and assessing visual motor skills, which is A, would not be beneficial in seeing what his orthopedic concerns are and using a dynamometer, pinch meter readings. They're so small, they probably wouldn't be able to follow the directions to even complete the assessment for those readings correctly. Okay, number 3, an OT working in a long-term care facility needs to evaluate the long-term memory of a resident, which is best for evaluating memory of personally experienced events, declarative memory. For this answer, I chose B, ask the individual how they spent their New Year's holiday. And I chose this answer because declarative memory is something that the client has experienced and been through. So, an event like New Year's is usually something that we all remember, and it's something that you can ask them to recall, and it's something that has happened in the past. They may not remember that exact New Year's, they may remember one prior to that, and we're just looking for long term memory. So, that question would be a good one to assess whether they can recall those events. A says show the person a series of objects and ask them to recall objects within 60 seconds. That would measure more so short term memory, so that's not appropriate. C says have the individual state the place, date, and time. That is more so geared towards orientation and if they're aware of where they are and which place and time right now. So that's not an appropriate answer for that question. And D says ask the client to remember a specific item to the next day in the therapy session. That is also kind of short-term memory, so it wouldn't be appropriate for this answer. Number 58. A person with a long history of Parkinson's disease is experiencing considerable fatigue during the day. The best way to enable the individual to maintain their level of function is to teach them how to, and I chose B, perform desired activities in a simplified manner to, to conserve energy. So I chose this answer because with Parkinson's disease, it is going to be a progressive disease, and fatigue is a symptom that you're going to a client is going to experience throughout the day. So teaching them how to modify activities in a more simplified manner, so they're not exerting energy every time, is going to be beneficial to that client. The answer A says work through the fatigue. that's not appropriate because they could end up either harming themselves and it's not safe for them. Answer C says employ pursed lip breathing. That is something that we can teach on top of performing that activity, but it doesn't um, teach them the exact way to best enable them to keep their prior level of function. We want them to continue the activity. We don't want them to stop. And then for D, the answer goes as well. It says eliminate activities or reduce activity level as much as possible. We don't want to reduce activities if we don't have to. If they're still capable of doing the activity, if we can find a way to either break the activity down, um, basically simplifying it, taking breaks to help with energy conservation, that's going to be the most beneficial for the client. Okay. Number 61. An individual with Guillain-Barré acute syndrome demonstrates poor to fair strength throughout the upper extremities. Which is the most appropriate approach for the OT to use when planning treatment for early stages? They are in the early stages of Guillain-Barré. I chose answer A, gentle, non-resistive activities. With Guillain-Barré, they're going to have muscle fatigue. Um, they're going to be weak, so we don't want to do progressive resistive exercises like in answer B. We want to continue having the client participate in exercise, but not to the point where we're overexerting them because they are going to fatigue easily with this condition. Fine motor activities, maybe persistent fine motor activities wouldn't be appropriate for this client because their fingers could fatigue in that moment. So anything that's non-resistant, fine motor activities, you're moving your hands, your fingers, dexterity over and over. That could be what we call more progressive or um, not necessarily what we need in this situation would be non-resistive activity, things that aren't you don't have to exert force um, while doing this activity. Okay. 65. Following radiation therapy for breast cancer, an individual develops lymphedema in the right dominant upper extremity. She is experiencing functional deficits and is referred to occupational therapy. Treatment to reduce the swelling will begin with, I chose the answer C, fitting of compression garments. I chose this answer because it was the best answer as far as A, which was changing the dominance training. We can't change dominance training overnight like that. So we're looking for the first step to treating this, and that's what we're going to begin with. Um, B was right upper extremity exercise using isometric contractions. So in that instance, we are looking for the first step to begin with. So we want to try to do is reduce the and help the fluid move back to moving the fluid back into the body. So fitting the compression garments is going to help do that. It's going to help to compress and hopefully move that lymphatic fluid back throughout the body. D was heat modalities such as warm compressors, and that's contraindicated for having lymphedema. So we wouldn't choose that answer. So C was my answer for that question. Okay, number 72. An OT is working with a woman with Alzheimer's disease who demonstrates mild to moderate decline. She lives with her husband who works during the day. The OT should initially focus intervention on which area? My answer was B, kitchen safety. I chose that because she is still going to be left alone at parts of the day, so she'll be independent in the home, and we need to promote kitchen safety to make sure that she remembers what to do, what not to do. And that's going to keep her safe because she is independent in this aspect, and this is the early stages of Alzheimer's, so she still will be able to participate in some tasks. For A, it's not appropriate because it says the ability to chew and swallow. That's something that you may see in the later stages, like the more severe stages of Alzheimer's, and we are not there yet. C, anger management. That's also another symptom we may see in the latter stages, and it is something that we will address, but we're not there at that moment, and we can still teach her to be safe throughout the home, and especially in the kitchen because there's so many hazards in the kitchen. D, recognition of family members. That's also a symptom that comes later on, that you may see that the individual may lose their memory and forget their family members, and that could agitate them. And that's in the later stages. We are in the mild to moderate stages of Alzheimer's. Okay. So 94. An OT is treating a restaurant worker with pain resulting from a cumulative trauma disorder. The OT suggests using elastic tape to decrease pain in the upper extremity while working. In addition to decreasing pain, this type of taping also, I chose A, decrease inflammation and edema. Um, that's what we're using kinesio tape. That's one of the benefits of kinesio tape. And what we're looking for is to reduce pain and trauma and edema. I'm sorry. The trauma from the pain is going to cause inflammation and edema. So if we're able to decrease that, the taping, that's one of the symptoms of the taping, which will help reduce those symptoms. B, the taping does not increase muscle fatigue. C, the taping should not be limiting range of motion. If it is, then it has not been applied appropriately, and it needs to be taken off, removed, and reapplied. And then D, desensitizing the upper extremity. The tape, that's not one of the benefits of the tape, and if that is causing that, then we should remove it and try again. Okay, 99. An OT is working with an individual with ALS who developed a sacral decubitus and has recently become too weak to turn himself in bed. What should the OT plan to do next in regard to client caregiver instruction? I chose C. Teach the caregiver how to position the client safely. So with ALS, it's a progressive disease. There is no cure for it. So the client is going to continue to lose muscle function and that kind of thing. So what we can do is we'll teach the caregiver to assist the client in positioning and relieving pressure relief, and changing positions. Because ALS, as we know, is a progressive disease, like I said before, and there is no cure, and the client is going to continue to decline. So teaching someone to assist with that is going to be beneficial, so that they would hopefully are able to relieve pressure and no longer receive any more pressure sores or sacral decubitus. For A, begin a strengthening program. Like I said, ALS is a progressive disease. The client will not be able to strengthen or recover in those muscles, so that item would not be appropriate. B, suggest that the client and caregiver begin a wheelchair education program. Like I said, the client is, if they're already in bed and they're already at that point where they're unable to roll, then you require more strength and more muscle engagement to roll a wheelchair, and the client wouldn't be able to perform those tasks. And then D, provide environmental control to the client. At this point, we are not there. I'm not sure if there's any kind of assistive technology that will roll a patient over to help them. Now, you have beds that can, adjust the height and the head and the foot of the bed, and that sometimes can relieve pressure on the back and certain parts of the body. But if we're talking about rolling, teaching the caregiver to switch positions at this point in time would be best. Okay, number 100. A hospital-based OT is working on discharge plans for a 2-year-old child with paraplegic spina bifida who has just started using a power wheelchair. Which community resource recommendation is the most critical for this child? I chose D, early intervention, because early intervention is going to help this child. They're only 2, and they're going to continue to reach their developmental milestones. Early intervention is going to cover all areas as far as mobility, cognition, teaching them and improving the ways that they're able to be mobile, use that wheelchair, and be able to move around. A was social service agency. At this point, I'm probably sure that the social services are already involved and providing resources in which ways that they can, hopefully. B, wheelchair equipment program. If the child is already in the early stages of using the wheelchair, then they're probably already involved with the wheelchairs equipment vendor. And then C, family physician. The family physician is probably going to be seen before that child even gets to OT. So that's why I chose answer D, early intervention program. 101, number 101, a client presents with chronic post-stroke upper extremity edema of the right arm and hand. Which would the OT most likely suggest to manage edema? So I chose A, manual edema mobilization. For this answer, it was the best answer to me as far as hot pack applications and paraffin treatments. With edema, those are contraindicated. Manual, um, sorry, they're not contraindicated, but they're not appropriate at this time. So manual edema mobilization is going to help the client with positioning is going to help, mobilizing, moving the arm around, teaching them exercises. Um, Range of motion is going to be most beneficial in helping and reducing the edema. If the hand is still, it's going to, the edema is still going to pull, and we want to be able to help them, teach them how to move the hand and get that fluid and edema, moving around and not being stagnant in one place. 102. An individual with left upper extremity spasticity is observed sitting at a table in his wheelchair at lunchtime with his left arm dangling over the side. The first positioning strategy the OT should introduce to in the individual is, I chose B, repositioning the arm back on the wheelchair armrest. And I chose this answer because we are talking about the first positioning strategy, which we want to make sure we adjust that patient and make sure that that arm is safe and that patient is comfortable and sitting in a good sitting posture, and placing it back in the armrest. And then from there, we can observe. I feel like we can further observe and see like what's causing the patient's arm to slide off of and dangle down on the side. So from there, we could see, is it slipping because they're unable to maintain upright posture? Are they leaning? Do we need to apply cushions? That's where positioning the upper extremity on the tabletop surface with Dysom. Dysom is going to help that arm to not slip. But like I said, we're talking about the first step. That might be a second step or a third step. Using an arm sling, that might be a third step or a last step in this process, as far as if the client is unable. If I don't think we want to put it in the sling unless the client is like needs to be immobilized. And that's why a sling is not appropriate. And then attaching a lap tray. A lap tray, I think, is like a second line after we observe that what's causing the patient to not be able to maintain their arm from slipping off. So, like I said, we're talking about the first step in this process, and that's why I chose repositioning the arm on the wheelchair armrest. 111. An OT is working with an individual who is status post right upper extremity shoulder replacement. The client is right hand dominant and an avid woodworker. Currently limited right upper extremity range of motion prevents participation in woodworking, which requires at least 120 degrees of shoulder flexion. The OT and the patient collaboratively develop a plan that incorporates woodworking to increase right upper extremity range of motion. After establishing the just right challenge at 40 degrees of shoulder flexion, to sand the pieces of wood project, how should the OT progress the patient to achieve this goal? I chose D, involve them in sanding and staining increasingly larger pieces. So I chose this because they they have made it to 40 degrees, and they are able to sand wooden pieces right now. And the Just Right challenges, we want to make sure that they are successful in completing the task, and they're still within their, we're increasing their function. So if we're doing smaller pieces, we can increase the size, and that is going to help with increasing range of motion. They have to reach a little bit further to sand those larger pieces in different directions, improving the range of motion. And that's why I chose D. Um, A, progressing them to power tools. Power tools require you to have some strength to hold on to them, so that wouldn't be appropriate. Um, and that power tool, it needs to be, we need to make sure that they're safe and that they're able to hold on to it. And I don't think that's something that they could do if their range of motion is only limited to 40 degrees right now. B, apply increasingly heavier wrist weights during sanding and staining activities. That's not appropriate because we want the patient to be able to freely move around. We don't want to make it harder for the patient at this point. We're already sanding, and I don't think we want to add more resistive um, activities to that, because that's just going to hinder them in a way that we don't actually need right now. We can do exercises in that, with the weights, but not during the activity. Um, we can, or C was provide them with tasks that require bilateral coordination. There was no mention of the left upper extremity in this case, which I assume would be within functional limits. Um, but right now we're working on increasing shoulder flexion to 120 degrees. So bilateral coordination would be more so crossing midline or engaging with that other hand, which I don't think is a bad thing, which you could probably possibly use that hand to help as a helping hand maybe. But in this situation, we want to be able to engage that right upper extremity as much as possible so that we can increase that range of motion. Okay. 123. An OT is working with a child, with a 6-year-old child who occasionally drops their utensils when eating because of a slight decrease in hand range of motion/grasp limitation. Which piece of equipment would the OT most likely recommend first? So I chose letter C, foam tubing around the utensils. And the reason I chose that is because the child is having an issue with a decrease in hand grasp. And if we give them a built up foam tubing around the utensils, it's still going to allow them to perform that task and be independent in that task without dropping their fork. So the problem is with grasp. A was swivel utensils, so the child is not having an issue with wrist movement or that kind of thing. So we wouldn't need swivel utensils. B, pediatric universal holders. Like I said, the child is having a problem with grasp, not with holding. It's with pediatric universal holders is not appropriate for that task. And then weighted utensils, if the child is having trouble maintaining their grasp, if we give them weighted utensils, they're probably going to drop that as well. It's going to be too heavy for them to grasp. So if a normal weighted utensil is they're unable to grasp it, then a heavier utensil would not be appropriate for it. So if the child is unable to fully form like a full grasp, a foam utensil is still going to let them be able to hold on, because it gives them more of a area to work with, and that they can maintain their grasp on a larger handle. 125. A 60-year-old auto mechanic with diabetes and impaired sensation in the residual lower limb has been referred to OT for prosthetic training following an above knee amputation. The first item the OT practitioner should address is I've chose A, skin inspection. So before we start anything, we want to make sure that the limb is clear of any sores or any, make sure the skin is intact and it's healed, the surgical site is healed, and that kind of thing, because that's the first line. Nail trimming for this limb, there was an amputation, so there is no foot to trim nails of. That was B. C, retirement planning, at this point, there's no reason to assume that the client cannot return to work. So retirement planning is something that's more further along in along the line, down the line. D is returning to work. So at this point, we are just seeing um, the client for they're having impaired sensation, and we want to make sure that returning to work is something that is further down the line. And then so answer A, the skin inspection, if they're having impaired sensation, then we want to make sure that they are able, we're inspecting the skin, because sometimes if you can't feel down there, then you're not aware of what's going on there. So they could have wounds. It could be which could lead to an infection. So we want to make sure that we are looking at the skin and making sure that everything is good and intact. 129. An OT is applying proprioceptive neuromuscular facilitation techniques for weight shifting during an activity that requires an individual to use the right hand to remove groceries from a bag on the floor to the right. The most beneficial would be gained from this activity by then placing the groceries. I chose D, in the upper cabinet to the left. So PNF works with positioning and increasing balance and engaging the core strength. And in activities that require movement from like range of motion. So if we're down here on the left, we're going to pick it up and we're going to go diagonal, and then we're going to go, if we're down on the right, we're going to, the groceries are down here on the right, we're going to pick those groceries up, move them up to the left cabinet. So that diagonal motion is what it's engaging. It's improving the ability to weight shift on both sides, engaging the core, which is going to make it stronger for the person to regain that range of motion and the ability to perform those activities. A, on the counter in front of them, that does not is not a PNF movement direction, so that's not going to be beneficial. So from the right to in front is not that activity. On the counter to the left, so on the counter to the left could be just here. So from the right to the left, that's not a PNF movement. And in the upper cabinet to the right, so from down and then up to the right, that's also not a PNF movement. So we're looking to engage that core and on both sides, with D, the answer of a PNF. Okay. 144. An individual diagnosed with chronic obstructive pulmonary disease is participating in a pulmonary rehabilitation program. Which will the OT most likely recommend? I chose A, perform pursed lip breathing when doing activities. For chronic COPD, we're going to enforce energy conservation, energy conservation, energy conservation. And pursed lip breathing is an activity that helps to conserve energy. So that's why I chose A. B, well, also while having the client being able to still participate in those activities while they can. Okay. A long-handled sponge while in the shower. That may be appropriate as we progress. If that individual is unable to perform the shower at all, like without becoming completely fatigued, then maybe we simplify the activity, or we encourage them to take rest breaks or something like that. That could help. C, taking a hot shower to reduce congestion is not something that we are addressing. That might be something more so for we can definitely suggest it as a way to help, but that's not something that's going to help with participating in their ADL activities. It can, but congestion, they're probably going to be seeing a respiratory therapist to address that more head on. D, avoid air-conditioned rooms during warm months. That's a suggestion. That's just, something that might work. It might not work. So performing pursed lip breathing while doing this activity, to me, is the best choice because they're able to conserve energy, and then we can also encourage them to take breaks while performing those activities. 145. An OT is fabricating a resting hand orthotic. device for an individual with extremely fragile skin. Which areas will the OT have to inspect most carefully for signs of skin breakdown? For this one, I chose C, which is the ulnar styloid, distal head of the radius, and thumb CMC joints. So, in a resting hand splint, we're going to see um, those are the points of contact that come in contact with the resting hand splint. You're going to see the ulnar styloid, the radial, the head of the distal head of the radius, and the CMC joint, and that's what we usually see with the hand rest. So those points of contact are more likely to experience pressure, where we might see redness and skin breakdown. So we want to make sure that we are um, looking at those signs. The volar PIP joints is going to be um, on the top side, or no, I'm sorry, on the top side of the hand, and no, on the top bottom. I'm sorry. But it's either top or bottom. It's not gonna be where the it's applying most pressure. That was B. Um, A, the metacarpal heads, the pisiform, and the trapezius. Here is not where we're going to see points of pressure with the resting hand splint. Okay. 147. Which are the most appropriate interventions for the OT to plan in treating a person following a total knee replacement? I chose C, providing ADL training in the use of adaptive techniques for lower extremity dressing and transfers. So, I chose this because as occupational therapists, we are working to help the patient regain their function in their everyday activities. So, training them after having a knee replacement, I want to make sure that that client, or I want to assess how that client is, how independent that client is in completing these tasks. Teaching them the proper way and the safest way to dress themselves and to get in and out of bed. Um, and that's what we want to address. We can also do strengthening, which is something that you'll probably see physical therapy work on most, but we can also provide exercises in that lane too. So A was using range of motion and strengthening activities for upper extremities. They had a knee replacement. Their upper extremities, we're going to assume, are within normal limits, so they should not have no issues there. B was provide range of motion and strengthening activities for lower extremities. Now that is all good, and we can use that in addition to, that would be used in addition to um, performing their ADL training, using adaptive equipments and lower extremity um, dressing and transfers. So that's something that we would add on to that, because as the role of OT, that's how we're going to plan our treatment and set our goals. D was observation and assessment of homemaking activities. That client is probably not home yet. I'm going to say that. And then we would not be addressing that yet at this point. All right, so last question. Okay, the administrator of a long-term care facility asked the OT who works there to help develop a job description so they may hire a second OT. What would an OT job description most likely contain? I chose D. You in a job description, you want to make sure you're adding the job title, employer's expectation, productivity expectations, and how performance will be measured. Um, that's very important to include. Clients are going to want to know, or potential employees are going to want to know what is expected at this job, what title it is, what kind of job it is, what the employer expects, and how their activity or their performance is going to be measured. So D is what I chose. A, it says previously established mutual goals, quality of patient care, achievement of predicted outcomes, and evidence of relationship building. Those are going to be something that's, to me, I think are really hard to gauge. And this is just a post to hire a new client. I think these are things that you could establish once the client is hired and you guys are having more conversations about what's going on the inside. B, a summary of primary and secondary job functions, references, and physical exertion requirements. Mm, I think as an initial post, these are things that would be secondary to ask after the fact, and maybe not necessarily need to be included in an initial post. C, organizational relationships, personality characteristics, and accomplishments desired in a candidate. I think once you move past the initial point, then we can definitely add these questions in. I think the A, B, and C, even though I didn't choose those, I think these are things that could be included, but not initially and maybe further along during the line. So that is all of the questions. Thank you for your time. Have a good evening.